Imagine two parts of your body that are not supposed to be connected. Now picture an abnormal passage forming between them. That, in essence, is a fistula. It's like an unexpected tunnel within your body. This tunnel can form between various organs or between an organ and the skin. Fistulas can occur in different parts of the body. They can be quite small or grow larger. The presence of a fistula can interfere with normal bodily functions. Fistulas are often a sign of an underlying medical condition. They are not contagious. Understanding what a fistula is can be the first step towards seeking appropriate medical care. Fistulas are categorized based on their location and the organs involved. Let's explore some of the most common types. Obstetric fistulas affect women, forming a passage between the vagina and either the rectum or bladder. This type of fistula is often a result of prolonged obstructed labor, a tragic complication during childbirth. Anal fistulas occur around the opening of the rectum, creating a tunnel to the skin near the anus. These fistulas typically stem from an infection in an anal gland. Arteriovenous fistulas are distinct in that they form between an artery and a vein. While some are present at birth, others result from injury or surgical procedures. These examples highlight the diversity of fistulas. Each type presents unique challenges and requires specialized medical attention. Understanding why fistulas develop can be crucial for prevention and treatment. Several factors can contribute to their formation. Injury, especially during surgery or childbirth, can damage tissues and create an environment conducive to fistula development. Post-surgical infections can also increase the risk. Chronic inflammation, often associated with conditions like Crohn's disease or diverticulitis, can weaken tissue walls, making them prone to fistula formation. Certain infections, if left untreated, can lead to abscesses that may eventually develop into fistulas. This is especially true in the case of anal fistulas. Sometimes babies are born with fistulas, known as congenital fistulas. These occur due to errors during fetal development. Recognizing these potential causes can empower individuals to seek medical attention promptly if they experience any related symptoms. The symptoms of a fistula can vary depending on its size and location. However, there are some common signs that should prompt you to seek medical advice. Pain, often described as throbbing or constant, is a frequent symptom, particularly in the area where the fistula is located. The pain may worsen with movement or bowel movements. Unusual discharge, such as pus or stool, leaking from an opening in the skin is a strong indicator of a fistula, especially anal or obstetric fistulas. Swelling or redness around the affected area can signal inflammation and possible infection associated with a fistula. Fever and fatigue can accompany a fistula, especially if it's infected. These symptoms are the body's way of fighting off infection. It's crucial to remember that these symptoms can also be indicative of other conditions. Therefore, a proper medical evaluation is essential for accurate diagnosis and treatment. Section 5. Diagnosis: Identifying the problem. Diagnosing a fistula typically involves a combination of medical history review, physical examination, and diagnostic tests. This comprehensive approach ensures that no detail is overlooked and that the diagnosis is as accurate as possible. Your doctor will begin by asking about your symptoms, medical history, and any recent surgeries or infections you might have had. This initial consultation is crucial for gathering all relevant information that could point toward the presence of a fistula. During the physical exam, the doctor will visually inspect the suspected area for any abnormalities, such as openings, discharge, or swelling. This step helps in identifying visible signs that are indicative of a fistula. They may also gently probe the area to assess the fistula's tract. This probing helps in understanding the depth and direction of the fistula, which is essential for planning further diagnostic tests. Imaging tests, such as ultrasound, Connecticut scan, or MRI, can provide detailed pictures of the fistula's location, size, and extent. These imaging techniques are invaluable for visualizing the internal structure and complexity of the fistula. These tests help visualize the fistula's path and surrounding tissues. By examining these images, doctors can gain a clearer understanding of the fistula's impact on nearby organs and tissues. In some cases, a fistulogram, a special type of X-ray that uses contrast dye to highlight the fistula's tract, may be performed to obtain a clearer picture. This specialized test can reveal details that other imaging methods might miss. A thorough diagnosis is crucial to determine the most appropriate course of treatment and ensure the best possible outcome. By accurately identifying the problem, doctors can tailor a treatment plan that addresses the specific needs of the patient, leading to better health and recovery. Section 6. Treatment options. Navigating the path to recovery. The treatment for a fistula depends on several factors, including its location, size, severity, and the overall health of the individual. Each case is unique, and a tailored approach is essential for effective management. Treatment options typically fall into two main categories. Medications, such as antibiotics or anti-inflammatory drugs, are often the first line of treatment, especially for fistulas caused by infection or inflammation. These medications can help manage symptoms and prevent complications. These medications aim to control infection and reduce inflammation, allowing the fistula to heal. Consistent monitoring and follow-up are crucial to ensure the effectiveness of the treatment and to make any necessary adjustments. Surgery is often necessary to repair or remove the fistula, especially if it's large, doesn't respond to medication, or causes significant symptoms. Surgical intervention can provide a more permanent solution. The type of surgery varies depending on the fistula's location and complexity. Surgeons may opt for different techniques to ensure the best possible outcome for the patient. Minimally invasive techniques such as laparoscopy or endoscopy are increasingly used to treat fistulas. These advanced methods offer numerous benefits over traditional surgery. These procedures involve smaller incisions, less pain, and faster recovery times compared to traditional open surgery. Patients can often return to their normal activities much sooner. The choice of treatment is a collaborative decision between the doctor and the patient, taking into account individual needs and preferences. Open communication and trust are key to achieving the best possible outcomes. Section 7. The importance of early intervention. Early diagnosis and treatment of a fistula are essential for preventing complications and improving outcomes. Delaying treatment can lead to worsening symptoms. As the fistula progresses, symptoms such as pain, discharge, and discomfort can intensify, significantly impacting your quality of life. Spread of infection. Untreated fistulas can become infected, potentially leading to abscess formation, sepsis, or other serious complications. Damage to surrounding tissues. If left untreated, a fistula can erode into nearby tissues and organs, causing irreversible damage. Increased risk of recurrence. Fistulas that are not properly treated have a higher chance of recurring, requiring further interventions. By seeking medical attention promptly at the first sign of a fistula, you can improve your chances of a successful outcome and prevent potential complications. Section 8. Living with a fistula. Living with a fistula can be challenging, both physically and emotionally. The condition often brings discomfort and can significantly impact daily activities, making it difficult to maintain a normal routine. However, there are ways to manage the condition and maintain a good quality of life. With the right support and treatment, many people find they can lead fulfilling lives despite the challenges. Following your doctor's treatment plan diligently is crucial. This plan is tailored to your specific needs and can help manage symptoms effectively. This may involve taking medications as prescribed, attending follow-up appointments, and making necessary lifestyle adjustments. Keeping track of your treatment schedule is essential for managing the condition. Proper wound care is essential, especially after surgery. Ensuring that the wound is clean and well-maintained can prevent complications. Keeping the area clean and dry can promote healing and reduce the risk of infection. It's important to follow the care instructions provided by your healthcare team. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and adequate sleep, can strengthen your immune system and support your overall well-being. These habits can make a significant difference in your recovery and daily comfort. Don't hesitate to seek support from loved ones, support groups, or mental health professionals. Emotional support is a key component of managing a chronic condition. Sharing your experiences and concerns can provide emotional relief and practical coping strategies. Connecting with others who understand your situation can be incredibly comforting. Remember that you are not alone in this journey. Many people are living with fistulas and finding ways to thrive. Many resources and support systems are available to help you navigate the challenges of living with a fistula. From online communities to local support groups, there is help available to guide you through this journey. Section 9. Seeking support and information. If you or someone you know is affected by a fistula, there are numerous resources available to provide support and guidance. Your healthcare provider is your primary source of information and support. Don't hesitate to ask questions, express concerns, and seek clarification about your condition and treatment options. Reputable medical organizations, such as the American Society of Colon and Rectal Surgeons or the National Institutes of Health, offer reliable information on various types of fistulas, their causes, symptoms, and treatment approaches. Online support groups and forums can connect you with others who are going through similar experiences. These platforms provide a space to share stories, exchange advice, and find emotional support. Remember that knowledge is power. By staying informed and seeking support, you can actively participate in your healthcare journey and make well-informed decisions about your condition.